and welcome everyone to the first program of this year's Public Health Week programs at the Public Health Museum. As we have done in the past, we have a panel of students who have participated in the summer program that the museum has been hosting for the past 12 years. This will be the 12th year. 12th year? Yeah, I think. Yes, 12th year. 11 years, 12th program this summer. And we're very happy that people can join us. And this will be posted on the website so that, as I said, people can use it as a resource. In the coming days, we have a program on Wednesday evening on pediatric HIV infection. For people in the area, several programs on naloxone treatment to reverse overdose, as well as a local public health forum on Friday morning. And everyone is welcome to those programs. And you can register for these free of charge programs on our website. Now, without further ado, I will introduce Sydney Whitaker, who is an alumna of Outbreak and has been a volunteer since she participated in Outbreak. And I'll let her describe her background and experience for you.
Hello, everybody. Welcome. I'm your moderator for tonight's alumni panel. My name is Sydney Whitaker. I'm from Boston, Massachusetts. I currently attend University of Connecticut. I'm a junior molecular and cell biology major on the pre-medical track. I participated in Outbreak back in 2020, the first fully virtual year. It was 2 weeks long. It was a wonderful experience. I learned a lot about the social determinants of health, various public health topics, public health nursing, emergency preparedness, and a lot more, which has led me to the career choices I've made today and my continued participation in the program today. So, welcome to our Outbreak alumni panel. I'm thrilled to have you all join us tonight. So in celebration of Public Health Week, the Outbreak program team presents a group of wonderful alumni who will be discussing their experiences in the program in our alumni panel. A wide range of panelists at a variety of places in their career will be discussing the ways Outbreak has influenced their career choices and personal interests. We'll be sharing the significance of public health topics in their lives, their personal lives, their careers, and the program's introduction to public health. We'll also be talking about their personal journeys through finding a career best fit in the public health space and ways that they have stayed connected with the program over the years. So the panelists look forward to sharing how Outbreak has provided the knowledge and guidance to pursue careers in healthcare, nursing, medicine, and so much more. So we thank you all for joining us tonight. And now I will have each panelist introduce yourselves. So I'm going to have you each go around and say your name, the position you are in your career. So if you're in college, if you're further along, career goals, when you participate in Outbreak, and other fun facts about yourself. So whoever would like to go first. Okay. Feel free to unmute.
Hi, I'm Seti Garakanian, and I'm an undergraduate student here at Northeastern in Boston. And I'm currently studying biology, and I participated in Outbreak in 2021 and also as a peer mentor in 2022. I had like a great experience with the program, and it's definitely like been a large influence even today. So yeah.
I can go next. My name is Kaya. I'm a junior in high school, and I participated in Outbreak in 2022, and I also was an alumni assistant last year in 2023. And participating in Outbreak has like sparked my interest in public health, and I hope to pursue a career in medicine in the future. And I'm looking into majors for college that have to do with public health. So I really enjoyed Outbreak.
Yep, I can go next. My name is Janvi, and I'm originally from Lowell, Massachusetts. I went to Lowell High School, but I graduated from the University of Pennsylvania in May 2022, and I majored in biology, but I also minored in anthropology and statistics. And so I'm almost 2 years post-grad working in pharmaceutical consulting, but I'll actually be beginning my MPH this fall at either GW or Emory, concentrating in health promotion. So I am switching it up a little bit. And in the future, to studying social determinants of health, either nationally or globally. I haven't decided yet, but I participated in Outbreak actually in 2017, so quite a long time ago, but I was actually a peer mentor during Outbreak 2020 as well.
Hi, I'm Vaishnavi, and I'm a junior in high school. I'm very passionate about pursuing a career in medicine, so I want to be a doctor. I participated in Outbreak last summer, and I absolutely love the program, and I would definitely recommend it to some of my friends this year.
I can go next. My name is Annabelle. I participated in Outbreak last summer. I'm a sophomore in high school, so on the younger age of people. So I definitely want to pursue a career in medicine. So I hope to do that in the future. And I think Outbreak kind of really put me on that track and helped me like develop my dream a little bit more. So
Awesome. Okay, do we have any more panelists that we're missing? No. Okay. So I'm putting the order. Oh, sorry.
Yeah, I forgot to go. And I have one more joining. It's just gonna take a minute, friend.
Okay.
All right. So I'm Drew Manglani, and I am a junior in high school. And so I really look forward to pursuing medicine in my future. And I feel like Outbreak kind of like aligned with my interests and allowed me to like further like experiment and like experience what I want to do in my future. And I participated in 2023, and I really liked it here, and I just want to be a peer mentor and help out for the rest of my time here.
Nice.
Yeah.
Okay. That wraps up the introductions to all of our panelists. Thank you guys very much. And without further ado, we will get into our questions. Okay. So the first one is very general. Why did you choose to join Outbreak? Whenever, if you were in high school, why did you choose to join Outbreak? And how did that influence your career today?
I guess I could start. So I learned about Outbreak through like my school counselor back in 2021, and I just thought it'd be like a fun summer activity because I really enjoyed my high school biology class, but I didn't really know like what I could do with biology. I knew there was like a lot to do with it, but I like to see like some concrete, like career options. Um, I thought about public health, but I didn't really know too much about public health. So I thought it was like a perfect opportunity to like learn more about this topic. And yeah, I thought it would be a perfect opportunity to explore different options. So that's kind of the main reason why I chose to join Outbreak.
I can go next. So I've always been interested in like medicine and biology, and I didn't know prior to Outbreak, I didn't know really anything about public health. So I wanted to explore more and just learn more about the different like fields in medicine. So that I think that's why I decided to join Outbreak.
Yeah, so during high school, I was actually involved in microbiology research, and my teacher actually got a flyer from the Public Health Museum about the Outbreak program and asked if we were interested in joining. So at this point, I never really had heard about public health or like how much in depth it went, but I was intrigued. I knew I liked biology, but all I knew was mostly in public health about epidemiology and just like studying bacteria in the lab, but I didn't know there were such things as preventive measures or interventions that we could take to stop disease from occurring altogether. So I wanted to see if the field was interesting, and it was.
During the spring semester of my sophomore year in high school, I reached out to my internship advisor to see if there were like any summer programs or volunteering opportunities for me to participate in. And she got back to me with like a ton of options, and one of them was Outbreak. And Outbreak stood out to me a lot out of all the options. And I'm like very interested in science and like medicine. And so while reading the program overview, I became very excited and curious about the topics, and I wanted to learn more about them. So
So I found out about Outbreak through my school's like little list they have of everything that's going on over the summer and stuff like that. So I saw that, and I think the first thing that stood out to me and sounds a bit weird was like the fact that it's free. It made it like really accessible. My parents didn't have to worry about like how much it would cost to get this like amazing experience. So that was the first thing that stood out to me. But like a doctor and stuff like that. So I like, I don't know, I saw it and I was like, this seems like the best option for me for this summer in a way that I can like further my goals more, but still be like accessible to me. If that makes sense.
Yeah, so I chose to join Outbreak because well actually I was recommended by my family members who all have like an interest in medicine as my aunts, and I have a family history of doctors. So I joined this program because there was nothing else in my area that like kind of like aligned with my interests, and I feel like this was a perfect opportunity to do something like that. So yeah.
Awesome. Okay. Yes, and I agree with you all. I think it's a fantastic opportunity to learn a lot about the field of public health. I feel like a lot of us don't know what public health really is, especially when we're in high school. So this is a fantastic introduction to various public health topics. Um, oops. So now we'll move on to our next question. How was your experience in general, and what did you think was the most meaningful part of the program for you?
I had a really positive experience both years that I participated. Everyone was like so nice, and um, everything was like really informational too. Everyone was willing to answer all our questions, and one thing that really did stand out to me was how organized the program was. I felt like we had like an agenda of everything we were going to be doing, and then I also thought like the time was really maximized, so we were learning like a lot in this very short amount of time. Um, but I thought that was really helpful for being introduced to a wide variety of topics. So there was like a lot of breadth and like depth in the topics that we were going into. And I felt like that was enough for us to actually like understand if this is something we want to pursue further. And then maybe like research on our own, or like continue down that path. So I thought it was like a great introduction to such a large amount of topics and potential career paths too. I also really liked how we got to be able to speak and interact with these like industry professionals. I thought that was like such a useful part of the program for us to like be able to network and then see these firsthand experiences in the field. So yeah, I think those were the main things that stood out to me about Outbreak.
Overall, my experience has been really inspiring. It solidified my like passion to pursue a future in medicine. So the most meaningful aspect for me would probably being like learning firsthand from the professionals about real world like problems that are going on that are very current. So I think that was the most meaningful for me. Like it gave me like a new perspective to issues that I didn't know before.
Yeah, I loved my experience in Outbreak. I enjoyed going on the field trips to the community health center and to the Massachusetts Public Health Department, where we got to study the mosquitoes, because you actually get to see public health in practice. And I feel like that's something that you not don't necessarily get in school. You're always in class. You don't really get the experience outside. So it was nice to be able to actually experience public health and just listen to all these various public health professionals come in and talk about what they do for a living. And honestly, I was just so surprised about how widespread and diverse public health was. And I also particularly enjoyed that zombie session where we tried to simulate an outbreak. And this was before the pandemic, COVID-19 pandemic occurred. So we had no idea how fast it could spread. But before that, I wrote about it even in my graduate school personal statement. Like that was the very first sentence I talked about was outbreak. So it was a meaningful experience for me.
I had a very great experience with Outbreak last year. I learned a lot of new things and improved my understanding in topics like infectious diseases, American pandemics, and also college prep and like careers in public health. And the program also got me more and more into wanting to pursue a career in medicine, and it taught me so many things I wasn't aware of before. I also loved the end of the program presentation that we did, and mine was coronary artery disease. And I learned a lot from it, and yeah, they were really impactful.
So I also had a very amazing experience at Outbreak. I think like being able to experience like in real time professionals like talking about the things that they've kind of like spent their lives researching and like getting to understand was kind of amazing to be a part of. And so I think for me, like the most impactful thing that I learned was about like the social determinants of health, like and how like the different like race and gender and stuff affects like public health and medicine, which I think getting to know all these like professionals in such like a close like manner made me like realize what kind of professional I want to be in the future and stuff like that. So it's like more of not just gaining information from them, but also gaining like
So I kind of agree with Annabelle. Like I feel like I was really inspired by the people here, and I feel like they set like a good like they're like a good influence on me, and I'm able to like learn from them not only like through information, but they're like how I want to be in the future. And also like one experience that I liked was like the projects that we did last year. Because I feel like that kind of let me like kind of branch off and pursue something that I found interesting. And yeah.
Great. I would like to echo, I'm glad you guys like the projects a lot. It's a great way to have a unique experience exploring a public health topic that's interesting to you. And we appreciated all of your presentations as well. Those were super great. I'd also like to echo the social determinants of health presentations, emergency preparedness. I think nursing was also mentioned. Those are all great topics that Outbreak has the opportunity to provide you all. Yeah. Okay. So next question. What was the most impactful session in Outbreak? So if there's a specific thing aside from the most meaningful aspect of the program, what would that most impactful session be?
For a long time, and still today, I'm like considering potentially going into a career that intersects somewhere with veterinary medicine. And we had one session, I cannot remember if it was 2021 or 2022, but it was definitely really impactful for me because there was a professional who came in who was working in veterinary medicine at like the state level. And so they were connecting public health with veterinary medicine, and that definitely it was like a light bulb moment for me that I can like connect these two passions and ways that I didn't really even think were possible. So that's just like an example of some of like the different sessions that also were impactful for me of thinking about how there's like different ways to look at these career paths possibilities. So that was one impactful session, and then there's one more that I couldn't choose between. One of them was we were learning about a doctor who was working in refugee camps, and so that was looking at humanitarian public health, and that was being able to see like anecdotal stories, and then also images from these this experience from this doctor. It was definitely really impactful to see that firsthand experience for sure. So yeah, those were probably my top two impactful sessions.
So I also couldn't pick between one session, so I have two favorites. So the first one is the social determinants of health equity which was led by Michael Curry. it opened my eyes to a lot of societal factors that influence health outcomes for many people, which I did not know about prior to his session. And it like taught me about the importance of advocating for these communities to help better their health. And also my second favorite was also the refugee one, because I just enjoyed seeing all the pictures and from the dermatology pictures. They were very interesting, and it was just cool how he took his time to go to these areas to help out.
Yeah, I think I also couldn't decide between the sessions. Honestly, they were all very interesting. So for me, I think it was also social determinants of health and health equity. And then we had Dr. O'Connell come to talk to us in person about his experience treating homeless people in Boston. And he actually gave us a book, which I still have on my bookshelf. But listening to these sessions honestly just made me realize how much of an impact outside factors can have on health, because in like school you learn about biology, you learn about the disease, you learn about how it comes about, but you never learn like how you can prevent that disease from occurring in the first place, or what are some things that you can do to make it less, I mean, to make it not as impactful or harmful to people who like suffer from these diseases. So that really impacted where I decided to concentrate in, which is health promotion, and just put into how we should create interventions for people, and just for health equity session in particular, I actually realized what the difference was between equality and equity. So I think it was between those two.
For me, all of the sessions and activities that we did in Outbreak throughout the week was very impactful because of the knowledge I gained from them. Each of the topics were like really unique, and they all focused on a certain like disease or like topic, and they all taught me so many different things I needed to understand as a person wanting to go into healthcare. And Outbreak has led me a few steps further into achieving my career goals and many of the positive impacts it has had on me. Um, so was so I learned like a lot of new things from all of the sessions. So I couldn't like really choose from one of them.
So for me, it was definitely the refugee crisis and like the people that were like in the refugee camps helping people. Because I think it kind of, I feel like as I grow up and stuff, we're like in a sheltered bubble. Like I guess America in general, like we think one step at a time, like in our own lives almost. So I think that this program kind of, or the session helped me like see beyond what I can do to help people like in America, but also like the world and how much like I can have an impact. And I think that was an amazing thing to learn.
Yeah, so I think that the history of public health led by Dr. Al Maria was probably one of my favorite sessions because it like stuck with me the most, and it kind of like opened up doors to public health that I've never experienced or experimented with before. And yeah, I feel like it kind of just expanded on my interest for medicine and like being a doctor in the future.
Awesome.
Hello, hi everyone. My name is Karan Kapoor, and sorry I'm late, but I joined Outbreak back in 2021. I'll give a quick introduction of myself. I joined Outbreak back in 2021. I was in India back then. Now I recently moved in America, and Outbreak has been a great opportunity for me. It directed me towards pursuing a career in medicine. It helped me grow, and the project I did previously with zombie, there was a project I did with zombie apocalypse project that we did last in the pandemic. It was a great sorry, am I cutting off?
Okay, thank you all for your contributions. would agree. All those topics are absolutely fantastic. You really get a great perspective on health equity, how various socioeconomic factors impact public health. And I think that's a really important topic that not a lot of younger people are aware of, but it is definitely an upcoming hot topic in healthcare at the moment. So next question. How did Outbreak impact your career choices or your personal interests? If you're going to college, what way did Outbreak impact your choice of major?
I feel like it definitely helped me solidify on going with bio because of how I kind of had like peace of mind that I have like options. Like it gave me like like an idea of all of the different careers that I can pursue with like bio, and then going into specializing public health if um in the future. So I feel like it definitely like it gave me peace of mind. I always felt like bio was for me, but public health and like knowing more about that, it helped solidify that decision when I chose that in college. And yeah, when I think about like for the future, what I'm doing like for personal interest, if I do like an internship in the future or maybe a co-op, it's definitely Outbreak helps me like orient myself in terms of where I want to specialize. And like yeah, it's given me kind of like a direction of where to go. So I feel like that is the biggest impact from in terms of personal interest, and then the major choice that I've chosen.
Yeah, Outbreak definitely showed me the different areas in healthcare and how like interesting it can be, and how it shows how you can like branch out and do your own research just to like dig deeper in what you find interesting or not. And it showed me how like there are a lot of different areas where you can personally go in, and depending on how like deep it is to you, you can like research it and find solutions for it.
So, Outbreak has like overall impacted my like future choices by because it solidified my like my desire to like go into health. So it really like after listening to all the sessions, I was like this is something I'm actually interested in. So in the future in college, I hope to if the college I attend has a public health major, I would definitely do that. And also just hearing from all the professionals about how the different paths they took, that was very interesting because it like I learned that there's not just one clear way to get to like a job you want, that I can study more than one like field regarding like health, and it was just really interesting.
Yeah, I feel like during my senior year of college, I kind of always knew that I wanted to go into the field of biology. I knew I enjoyed genetics and I loved math. So actually, I was originally a bioengineering major. I think the Outbreak program did help me solidify that like I wanted to go into the bio realm. And then during my spring semester, my freshman year of college, I made the choice to pursue biology solely and major in it, since that kind of aligned more with what I wanted to study. And I had the opportunity to take more flexible elective courses. And then the fall semester of my sophomore year of college, I took an urban health class. And this is what kind of drew me back into public health again. The next semester, I took three different classes in public health and within the anthropology department as well. That's why I was able to minor in it. Most of my classes were focused on medical anthropology and public health. And actually, I was originally pre-med when I was in high school, but honestly, when I reflected on it, I realized that I was actually so much more interested in learning how to create interventions and just not solely the human body. But I decided to pursue that FH so that I can actually go implement these interventions and practice public health. And if I hadn't been in Outbreak, I honestly wouldn't have known about the countless career choices that could come from this field, and I wouldn't have even known about the field of public health, and I maybe would have been doing pharmaceutical consulting forever. So I'm really thankful for the program for giving me that background to be able to pursue a different field that I wouldn't have normally done before.
For me,
sorry, I started getting into wanting to pursue a career in medicine at a very young age. So I would say around like fourth or fifth grade. And Outbreak helped me want to pursue a career in medicine or like healthcare a lot more. I understood what public health meant, and like I learned about a lot of like various different topics in public health, which definitely helped me um understand that I wanted to actually go into medicine and like study bio or like neuroscience when I get to college.
So kind of like what people said before me, I think that Outbreak kind of allowed me to see that there's not one way to go about maybe like what you want. So I think it kind of just gave me peace of mind that like I will get to where I want to get no matter where that is. And I think that like participating in all the sessions and everything, kind of like meeting all these different people with different career options gave me like the hope that no matter what I major, no matter what I end up doing within the medicine field, that I know that I'll find something right for me, no matter what it is, because there's so many options. So I think it could just help me realize that.
Yeah, like I said earlier, Outbreak kind of like opened new doors to public health that I've never like known of before, and I feel like that kind of just supports my interest in like medical sciences in general. And yeah, I'm currently in high school going to college, and I don't know what I'm going to major in yet, but I feel like this definitely has some influence.
All right, perfect. Thank you all for sharing. It sounds like you all have very bright futures ahead. So I'm excited for all of you. All right. Okay. So our next question, what clubs, extracurriculars, and outside career interests, so personal interests, were influenced by Outbreak?
This is kind of I don't know if this is like career interest, but or personal interest, but I do research on campus in a lab that is focused on like the Lyme disease. Um, and I feel like my research is so much more informed because of the foundation that Outbreak helped form for me. Especially in terms of like epidemiology. I think like that is kind of what started my interest in like learning more about pathogenic diseases, vector-borne illnesses. And I feel like without that, I kind of don't think I would have been interested in this lab at the very beginning. So I feel like that has really helped me pursue this research opportunity that I didn't wouldn't have had without Outbreak's experience. So that's kind of the big thing that I would give Outbreak for my personal interest right now is research. Yeah.
So, because of Outbreak, I began volunteering at a local hospital. So that was definitely something that I was like motivated to do. And I'm also starting to volunteer with the Red Cross. So that was something I was interested after learning about like emergency preparedness and stuff through Outbreak. And then an additional thing, for my AP research class in high school, I am working on a paper about how TikTok can be like a platform to promote public health. So that was something that I thought of because of Outbreak. So
Yeah, I had a lot of my extracurriculars focus on public health that kind of came as a result of Outbreak during undergrad. So I was involved as an events coordinator for a club called UNAIDS at Penn, which is an organization dedicated to ending the stigma related to HIV and just providing access to PrEP worldwide. I also volunteered at the Philadelphia VA, so the Veterans Hospital, and worked as a research assistant in the Center for Healthy in a study incentivizing healthy eating. And I also did my undergraduate thesis on a novel bacteriocin that is capable of killing MRSA. And honestly, that lab experience would not have solidified if I hadn't seen the impact that public health has, and just like lab work has in public health if I had not gone to that Mass Department of Health field trip and seen those labs in person. And I also volunteered with students who were sent to an evening reporting center, and though that's not directly public health related. Did volunteer with the students who, instead of juvenile detention, were sent to this eating reporting center in life plan, schools, and goals. And I think that truly has an impact also on public health. You may not realize it, but there's so many like factors that can go into public health, and that is like it's one of the ones that you can start from the very beginning and implement. And currently, I actually also help out as a social media coordinator for Move Up Global Works, which is dedicated to eliminating tropical diseases in Rwanda and to establish a girls' corner there for menstruation products. And if I hadn't been exposed to Outbreak, I don't know if I would have pursued all of these different things. I think that in school and college, like when I went there, everyone was honestly pre-med focused, and it was hard to figure out like what organizations kind of fit my mission statement. But because I had that background that came from Outbreak, I knew exactly like what path I wanted to go towards or what things I wanted to volunteer for. So it really helped me open up my mind.
I had a great interest in science, and after completing the master's program, I got more into science topics. So for instance, this year in my school, I started taking more science classes, and I'm currently taking anatomy, physiology, and chemistry to learn more about like the human body and like diseases, etc. And Outbreak has led me to become more aware of science news and topics in society today. And I'm really grateful for all the influences Outbreak has in my life so far.
So oh my God, I just completely forgot what I was gonna say. What was the question again? Oh, about activities. Okay. I have been a part of the HOSA club since I started high school. I don't know if anyone knows HOSA, like health occupations driven students. So I since I decided to do a like public service project or community awareness project. So I worked on like making sure people in the community, like in my high school and like the surrounding areas, were more aware of like how people, I guess, the stigma against like sexual assault and like rape of women. And so I think that like Outbreak kind of allowed me to see that there was like a more like community based, like not just global impact I can make it, like even though I'm just in high school now and I to go. Yeah, it just kind of helped me solidify that idea that I can make something, like I can make an impact now instead of years from now.
Yeah, so Outbreak also influenced my decision to take more science-based classes in high school, as it kind of showed me like how I can connect all these things together in the form of public health. And it also like solidified my career choice, as initially I was like debating between computer science and like anything medical related. And yeah, I chose uh medicine obviously because of this extra influence by Outbreak. Yeah.
Awesome. Yeah, it sounds like you guys have lots of fantastic extracurricular interests outside of school, work, and outside of your career, which I really appreciate. I'm also part of a social determinants of health program. I feel like that's a big impact that's felt by all of us through this program. So I work with a bunch of patients at UConn Health's outpatient clinic, and we screen patients for the social determinants of health and connect them with resources and check back in with them periodically. So, you know, health equity, social determinants of health, those have been very impactful for me, and I'm sure for all of you as well. Okay, so next question. This is a bit of a long one. I'm going to read a paragraph talking about the topic from this week's National Public Health Week. So the National Public Health Week topic is protecting, connecting, and thriving. The National Public Health Week website states, public health is more than just healthcare. It's the steps we take to make sure our neighborhoods and environment are free from pollution. It's making sure our food and water are safe to eat and drink. It's also the relationships we foster in our communities. We're all interconnected. When we all come together to support public health, all of us, individuals, families, communities, and the public health fields can achieve the goals of public health. How would you describe ways we can protect, connect, and thrive with one another through public health? And there's no correct answer to this. This is however you would like to interpret it.
So I feel like if someone doesn't know too much about a topic, it can be hard for them to actually care about it. So I feel like public health education is like a big factor that first comes to mind. It's by like making sure that individuals are actually educated on like these topics. I feel like that's what's going to lead to individuals caring about these community responsibilities and also like understanding the importance and where they actually stand in making a thriving community. So I feel like by being able to understand the scale and factors that actually go into public health and how interconnected it really is, I think education is a major component of that. And so I think that's like how that's the first thing that comes up to mind of how we can better be able to see our place in the interconnected community that it takes to actually um, build public health and make it thrive.
So I feel that raising awareness about different public health issues is really important to promote public health. This like includes like promoting vaccinations and um, having people learn about like food safety, and also like addressing social issues that like finding the causes of these social issues, like such as poverty and like lack of education in certain communities are important factors to help overall public health.
Yeah, I think that if we like genuinely show like what public health is about and like show some specific problems that people are dealing with, then it'll allow people to like really touch bases with it and create that desire to want to help and want to educate themselves about it.
Yeah, like Kaya mentioned, like the first thing that came immediately into my mind was vaccinations when it comes to protecting each other through public health. My own family, honestly, at one point refused to get vaccinated for COVID, and it was up to me and my younger sister to convince our parents that getting vaccinated not only protects you, but others as well, and it protects those who might be more vulnerable from becoming sick. And it's also just important that we have basic sanitation procedures so that we can stop the spread of disease and protect each other. And I think, like others have mentioned, the ability to connect with people from different backgrounds is vital to public health.
About current public health problems to improve their understanding of science and how to apply knowledge.
Sorry. I was talking about the ability to connect with people from all different backgrounds. It's definitely vital to public health. And whether this be going from people's door to door in villages or initiating these relationships through social media, it's important that we connect with each other because only then we'll have a better well-being. And as for thriving, we should just recognize the physical, mental, and emotional impact of issues ongoing around us and remember to check in with each other and just promote healthy habits by example, which is obviously easier said than done.
Yeah, I actually agree with what John talked about. So I would say public health is where like we spread awareness about a certain topic or issue and like educate our community on that topic and take further steps into like protecting and connecting with each other to prevent a certain disease or like whatever we're trying to, spread awareness about. So for example, I'm actually doing a passion project on cancer awareness. So I would say it could be more like a PSA where like the student or public health professional would like teach the community about the topic, like holding workshops for younger children to learn more about it and like raising awareness about cancer in the community and like teaching people what it basically is. And public health would be implemented in this where we can like work together to protect and like educate individuals on the topic.
Yeah, for me, the first thing that came to mind was also like public education and stuff like that. But I think for me specifically, like the social and health, like inequities and disparities in like the medicine and public health in general is like a really important thing to address and people to like better understand because it was something I had know very little about until Outbreak. So I think that if more people like understood it and knew about it, we could try to like start and like fix it, which I think is really important for like the future of people and like the different demographics we have in like the country. So I think that public education is really important, like people said.
So I think that it's hard to feel empathy for people without like being educated on the root of the problem itself. And I feel like spreading awareness is like the key solution to this issue. And so I feel like the promotion of public health helps like teach people who are unfamiliar with its background to protect, connect, and thrive in a community. They're now able to feel empathy for people who are in need of support, and I feel like this just supports the overall well-being of the community as programs like this and like others mentioned, like on TikTok, you could spread awareness, which kind of attacks the root of the problem and helps the spread of public health, which is important.
Okay, great. Yeah, thank you all. I agree. I think that education and awareness on various public health topics is a great way to grow our community and protect each other from a wide variety of diseases, illnesses, and really anything you can think of. So we're going to move to our final question of our panel. Thank you all for participating. So what are some of the ways the Public Health Museum has supported you all in achieving your career goals? And what are some other ways you would like to engage with the museum?
I want to say like I feel like because the program and this was said earlier, because it was just so accessible, one, it being free, and then also two, just I did it on the virtual years, but even with that, it was made so accessible for all types of individuals, and I feel like that was very helpful for it to have like such a large impact. The other thing I wanted to say was that it really again like gave me such a good visualization of the different possible career paths, and that I feel like has supported me even to this day of thinking about what I want to do with my future. And so those two things I would say is like what really has helped me to this day. And for the future, I would definitely like to help develop the Outbreak program in any way that's needed, and also to help provide this experience for more generations to come.
Participating in Outbreak gave me an opportunity to learn from healthcare professionals, which is something I would have never gotten to experience like just through my high school. So that was definitely something that has really impacted me for the future. And like by working as an alumni assistant last year, I got to like not only learn from these professionals, but I also learned how to like communicate with them, and just overall like Outbreak has taught me a lot about like the professional side of like healthcare people that I would not have access to through my high school.
Yeah, so I became a peer mentor. Actually, originally I wasn't able to help out the summer of 2019, but I did get to actually help out the museum virtually. And then I also became a peer mentor during COVID and was able to establish a relationship with one of the directors of health equity at the Mass Department of Public Health through this program. And it honestly has just provided such a solid network of people involved in all aspects of public health. And I think the foundation that like
I think if we start building more basketball courts, if we start building more
yeah, I think just the experience that Outbreak has provided me.
said we can build a better.
Okay, I'm going to continue. Let me sorry, I just lost my train of thought. I think yeah, the foundation that Outbreak gave me was just honestly so impactful because it showed me like what classes I was interested in taking in college. It showed me that solely biology wasn't the only field that I could pursue, or I didn't always have to go into medicine solely. I could do other things with the biology degree that I had, and that I could actually impact the lives of so many people with public health. And that's what kind of also kind of drew me into public health again, the fact that you can impact a lot of different people, and through just like various interventions. And through the museum, there's just so many opportunities to be involved, and just being as a volunteer and then having access to these panels and all the different trainings that go on throughout the year. I think I would just like to help with coordinating those events, anything like such as trivia or movie nights, especially connecting with the younger audience, because I feel like a lot of people, even in our local area, don't even know about the Public Health Museum. So maybe just like some sort of tabling at career fairs during high school or colleges, or a public health carnival, kind of teaching people about how public health can impact their lives. So I think that's something that I could help out with.
Yeah, I also think that like interacting with the public health figures was really impactful for me, especially because it really showed me how like um how they can like inspire you to like go into that type of topic, and like being able to like join meets like this and being able to like have the opportunity to like really dig deep in your career and like see like really why you want to do it and stuff. It really like helps me like solidify my future, like the other question. For me, public health is closely related to the career path I want to follow. And the Outbreak program has given me many opportunities to like learn and educate others on like various topics. And I would love to be part of the museum's Outbreak program, as it will give me the opportunity to learn more about different topics and like educate others on public health.
So I think for me, Outbreak really kind of solidified the idea that there's more than just one path to like being a doctor. You don't just have to be a doctor. You can have, there's so much more impact you can make in like the communities and like the world. So I think that just participating in Outbreak program and helping out whatever way I can to make sure like other people can see that there's just not one path you have to take to in the medical field. So I think that's just something that a lot more people should know about and join public like Outbreak for that.
Yeah, I agree with you, and I also feel that Outbreak really supported my journey to join the medical field, as not only did it like educate me and help me educate others, but it also like helped me uh like make progress in high school, in order to get into a good college and pursue health further.
Okay, great. Thank you all for your contributions. I definitely agree. There's many ways the museum can support us going forward. We have plenty of alumni engagement events, such as our panel. So plenty of ways to engage with the program going forward. Okay, now that we've completed all of the moderated questions, does anyone from the audience have any questions for our panel? If not, we're nearing 8. Okay. Well, thank you all very much for participating. Oh, sorry.
I think Kathy Hersham would like
Yes,
to say something.
I don't have a question, but I have to say you're such an impressive group. And one thing that I was delighted to hear is how closely you paid attention to the sessions. But thank you very much. It was really quite nice, everything that you said, and it's nice to see it had an impact, a positive impact.
So, yes, thank you very much. We appreciate it. We appreciate everybody who puts together the Outbreak program for us. It's a fantastic experience and it's very impactful for all of our careers. So thank you
Yes.
all for joining us. I look forward to continuing to connect with you all, and I hope you all enjoy the rest of this Public Health Week.
And thank you all for participating, and thank you, Sydney, for doing a great job moderating this session. Good night, everyone.
Good night. Thank you.